Good evening, everybody. We are happy to be here and to introduce in our meeting something special, and we want to thank the organizer and to Allergan for these excellent opportunities. For us, it's definitely a new step forward. Actually, you know very well, every morning when a plastic surgeon are waking up, they believe they are God and plastic surgeon. Now they're supposed to be English gentlemen. Okay, our debate will be today very special because the organizer proposed us something about Oxford-style debate. We are really in the middle of this special debate. What are the rules of this debate? First of all, I'm the chairman, and all the people here must address me with Mr. Chairman. And the motion for today is this house, Allergan Company, consider and believes that anatomical implants offer better aesthetic results than round implants. Great. Okay, proposers. Mr. P.G. Heden. Second proposers, Mr. William P. Adams, actually Bill Adams. Please. Okay. The other side. Okay. Wait. Opposers, Mr. Michael Jesus Scheflan.
Jesus.
And seconder of the opposer is Mr. Giovanni Botti. Okay, I will tell you something about the structure of this debate. First of all, every speaker from the proposer will be invited to speak. The opening proposition, Mr. Heden, 10 minutes. The opening opposition, 10 minutes, Mr. Michael Scheflan. Second proposition, 5 minutes, Mr. William P. Adams. And second opposition, 5 minutes, Mr. Giovanni Botti. The other 15 minutes, we are waiting for you, questions, and if you want, debate or encouraging a part of the other one. Then, after these 15 minutes, you just get an idea from which part you want to put your vote. And I want to show you now that you have already received this kind of orange cards for the debate motions, or, once again, look carefully, and a blue one against the motion. No slides or visual support can be used, but speakers may refer to notes. Strict adherence to time, actually... Oh, where is my bell? Here. Oh, it's heavy for me, but it's a nice task. 1 minute before finishing the time will be 1 ding. Oh, it's impossible. 1 ding. And when the time is finished, 2 ding. Stop. Okay, it's indicated the task of the proposers. It's proposed a topic with constructive arguments and the use of supporting evidence. The opposing team must oppose the resolution, but both rebutting the arguments of the proposition through the use of constructive arguments and supporting evidence. Please pay careful attention to the exact wording of the motion. Okay, let's start. Mr. Per G. Heden, please. 10 minutes.
Thank you, Mr. Chairman. It is frequently claimed that it's impossible to judge if a patient has a round or an anatomical implant. looking at the postoperative situation. I'm sure that our opposers will claim this later on. This may be true, but only if we have certain and specific conditions present. I would actually offer to operate two patients, one with round implant and one with anatomical, and produce a nicer appearing upper pole with the round one, provided I place the implant in the wrong place. Now, if we should compare patients after the augmentation, the condition has to be the same. That means that we have to have the implants in the same position in relation to the muscle. We have to have the same grade of capsular activity. And we have to have the same type of breast. Now, if these conditions are not the same, we cannot compare the conditions. Also, if we should make comparisons, we have to have the preoperative situation related to the breast later. So, we cannot just see two pictures after an operation and try to judge if this is anatomically round. Now, it is true that the round implant becomes anatomical in standing position, provided that it's filled with the low cohesive material. But only if there's no capsular contraction. And to compensate that, you may say that the saline implant is overfilled to give a more fullness in the upper pole. And then you get the rounded appearance again. Now, the standard low cohesive filler that becomes anatomical in standing position has another problem. It becomes wrinkled and rippled in the upper pole. And what does that mean? That means that it wears more. And it's quite likely that these implants will have a higher risk of rupturing. Now, so this is not just a question about round or anatomical. It is also a question about filling. What type of filling material, what amount of filling, and the cohesivity of the gel. So if we should compare apples to apples and pears to pear, we have to have those situations comparable. Now, speaking about round versus anatomical, there is no doubt that if we have the same filling material, high cohesive silicone gel, the anatomical implant will look much more natural in the upper pole. Now, this is not only true for the upper pole, because also the lower pole becomes more natural with an anatomical device. Especially if we think about situations like the contracted lower pole, where we get a lot of projection, for instance, from the style 510 anatomical device. Now, what about patient preferences? Well, the stereotypical picture we get from the media is that patients want a rounded, unnatural, artificial appearance. That the standard patient coming for a breast augmentation is a young girl who wants big breast. Well, we all know that that's not true. The truth is that the standard patient is 30 to 40 years of age. She do not desire a big breast. She desire a natural breast. She desire a youthful breast. And this is the situation where the anatomical implants do much, much better. Now, we also have the issue of rotation. I'm sure our opposer will discuss this as a major drawback of anatomical implants. And we have to acknowledge it. Rotation can happen in anatomical devices. But on the other hand, provided that you learn the technique, select the implants in the proper way, and above all, you perform the surgery in the correct way, then the rotational problem is hardly not there. In our first evaluation, it was 0.42%. Not the major drawback. You wouldn't have the rest of the 99.5 patients having a rounded, unnatural, artificial breast because of that 0.5% rotation. Now, even if it was 1% with widening cracations, it's not the major problem. Another really big advantage with this system is that we entered from doing a standardized round augmentation to have a multitude of different shapes available. Now, we entered into a situation where we suddenly custom make the breast, shape the breast in a customized mold. This is something that's not available in the rounded devices. If we compare form stable versus non-form stable, I think we can conclude that the evidence are quite clear that it's more beneficial in most situations. For instance, when it comes to the risk for rupture. We know from our recent research that the rupture frequency is almost 5 to 30 times lower in the same time frame compared to a low cohesive filler. Good benefit and something that's appealing for most patients. And also, if we are unfortunate to have a capsule contraction, the high cohesive gel is more resistant to spherical deformation and shape change. So that part of the discussion is quite clear. Form stability has great advantages provided you do the procedure in the right way compared to non-form stability. And if we compare form stable round to form stable anatomical, I think there is no doubt what you're going to vote for in a little while. I think I have too much time to argue for this motion because I think it's a clear-cut situation for me. I just want to conclude that we are in a situation when we select anatomical form stable devices, breast shapers, compared to non-volumetric, non-form stable implant stuffing of breast. And I will look out over this audience and see your judgment. And I'm sure that the ones of you who will vote for round implants also acknowledge that you belong to the breast stuffers. By this, I want to rest my case.
Thank you very much. And thank you also that you saved me to use this instrument. Actually, I have more 10 minutes. Now let's move on to the opening opposition. 10 minutes for Mr. Jesus Scheflan, please.
Good afternoon. It's not Jesus, it's Yehoshua. Yehoshua is Joshua, and Joshua, you know, Jesus' name was Joshua, and Joshua was my grandfather. So it's Michael J. Scheflan. Used for the first time, never used it before. Well, I rise to my feet only to praise my honorable opponent, Dr. P. G. Heden from Stockholm. And his admirable, courageous, yet questionable statements would have been a difficult act to follow had there been supported by any scientific data whatsoever. Such data does not exist. The only paper comparing anatomical to round implants was written in June in the American Aesthetic Surgery Journal in the States, and the authors are Friedman and Scheflan. And in that paper, showing pictures of patients to 250 women and 11 plastic surgeons, the pictures of the women having round implants scored higher than anatomical implants. However, attempting to compare two implants based on their shape differences only is doomed to fail. And as you noticed, my honorable opponent tried to take the discussion away from the motion. And the motion said that the House believes that anatomical implants are offer better aesthetic results than round implants. It didn't say anatomical form stable versus round responsive, nor did it say anatomical form stable versus round form stable. It says that if you do it right, every time you use an anatomical implant, you'll get a better result when compared to a round implant. So I think what he means, even though this is not in the motion, that a form-stable round implant offers a worse aesthetic result excuse me, when compared to an anatomical form-stable implant every time. If we try to compare two implants based on their shape differences only, we omit such parameters as implant site, degree of fill of the implant, gel viscosity, texturing properties, and form stability issues, all of which were not in the motion. It is therefore makes this attempt to say in a very wide fashion that anatomical implants in the hands of experienced surgeons offer a better aesthetic result every time when compared to round implants will not succeed. To the point that is in the heart of this serious debate, I would like to suggest the following observations. When you look at your patients year after year, you will certainly ask yourself quite often, why is it that some of your patients look wonderful long-term while others look worse every year? Why is it that some of the implants that you have used seems to stabilize and preserve a young and perky looking breast, while others accelerate breast aging? Why is it that you, as a surgeon, made your choices every time the same way, and yet some of your patients look good, while others look bad? It is a belief of this author that implants that are too big, too heavy, too wide, too projectile, will stretch and manipulate the soft tissue of the patients, even if we don't want them to. They will act as tissue expanders. They will stretch and thin out the tissue irreversibly. Our ability to control this phenomena is reversely related to the balance between the implant's dimensions and volume and the patient's soft tissue characteristic. The more imbalance, the less control we have. In a well-padded patient with more than 3 centimeter pinch in the upper pole of the breast, any implant, round or anatomical, well selected in its dimensions, width and projection and size, will do the job long term. In a thin patient, on the other hand, sometimes a carefully selected anatomical implant has a role. Therefore, there is a role for anatomical implants. However, anatomical implants have also some disadvantages, such as cost, for example. These implants are much more expensive than round implants. They also need a quite intricate, complex, sophisticated, with a high learning curve of planning and execution. If you just saw the deliberation we go into by measuring the place of the incision in the inframammary fold, which is where we do it from most of the time, you will see this is quite complicated and difficult. This operation, doing breast augmentation in every breast augmentation with anatomical implants, is much less forgiving to doctors' mistakes in choosing an implant. Because, as we saw this morning, by having an implant that is form stable and having the tissues adapt to the shape of the implant, your incision and your execution and planning has to be flawless every time, or you'll get unforgiving results which will increase your rate of reoperation. Finally, the incisions are longer, at least 5.5 to 6 centimeters to place an anatomical implant, even in a skinny lady, and they are firmer. They have to be firmer in order to maintain that shape, and that's especially where you need them the most, which is in patients which are very thin, and I will not say a word about rotation. Therefore, ladies and gentlemen, when you come to make your vote this afternoon, this is not just a trivial decision that you're going to make here this afternoon. This decision is of paramount importance. I first would like to remind all of those who were on the boat with me yesterday and on the bus, your envelopes are waiting for you at the registration desk. And finally, I think to say there's no question that there's a place for anatomical implants. They increase our variety and our versatility in offering treatments to our patients. I do believe that in thin patients with soft tissue coverage, which is very thin, these are good, but I think that in the overall majority of our patients, the selections of the dimensions and the size of the implant in relation to the patient's tissue's quantities and qualities will do the job every time, and I thank you for your support.
Now I invite you the second opposition speaker, proposition speaker, yes? Dr. William P. Adams, please. 5 minutes.
Very nice color, I think, don't you? Everything my partner, Heden, said is very good, and everything the other guys say is rubbish. That's all I have to say. No. Mr. Chairman, ladies and gentlemen, this motion is clearly true, and the answer is in the science. Remember that our goal in breast augmentation, and for any procedure for that matter, is to provide the absolute best possible outcome for the patient. That is the truth of what we are here for as plastic surgeons. The motion that we have here is that anatomic implants give a better aesthetic result than round. Now let's consider what those words mean. Better aesthetic means, in breast augmentation, a long-lasting result, something that doesn't look good at 6 months, but long-lasting, excellent cosmesis with no complications. And I think the answer to this is in the science. You've heard some of these studies in the past 2 hours, but what implant, through multiple studies, has produced superior results now in this discipline? You've heard about these before, but I'll cite some of them again. Heden study in 2001, the multiple patient, highly controlled FDA clinical pre-market approval studies in the United States. Mitchell-Brown's study on the 410 highly cohesive gel implant in 2005, and John Tebbett's study of the 410 implant in 2006. What type of implant is being used in all these studies? Let's say primarily the highly cohesive gel, form stable, 4-style 410 implant. Now I would like to comment on my esteemed colleague Dr. Scheflan's quotation of his published study. And with all due respect, I have to say that we're comparing apples to oranges with that particular study, because in my opinion, that is not the science of that study is not well controlled. I think that if you look carefully at that study, consider three things. The tissue variables in those patients were not controlled between the patients. So how can we compare patients who have not had the tissue variables controlled? Also, the implant selection and the techniques for planning were not disclosed in the article. So how is the reader to make a true conclusion based on that? And lastly, what implant does Dr. Scheflan use in his practice primarily? Form-stable anatomic implants. So if he truly believed the results of the study, I think that he'd probably be using a different type of implant. But in summary, what I would tell you is that the science has demonstrated the best result known to be with these anatomic form-stable implants, or at least let's just say form-stable implants at this point. So we know that form-stable implants produce the best results. And now the only question is, we know that form-stable implants also do not collapse in the upper pole, and therefore an anatomic shape is the preferred shape of a form-stable implant to produce the optimal breast aesthetics. And hence, I would tell you the motion is clearly true for this reason. Anatomic implants do give a better aesthetic result than round implants. Thank you.
Now I invite Dr. Giovanni Botti for the second opposition speech. 5 minutes, please.
Okay. Good afternoon again. Everybody knows that Dr. Heden and Dr. Adams are really very good and honest guys. And this is the reason why I was just wondering why they were telling such funny jokes about anatomical implants. Because I really don't understand. Perhaps Allergan promised them a huge amount of money if they would have selling more anatomical implants no other way. Anyway, are anatomical implants truly superior in shape? To me, no. They look different, for sure, not better. If you compare photographs of the results one can obtain with the two different types of implants, in the majority of cases you will hardly see any difference. Just to tell you, when a patient comes to my practice asking for a breast enlargement, usually they say to me, doctor, you are going to use, in my case, anatomical implants, are you? And I answer, I use what is better in your case. And I tell them, we will play a game if you like. And I show on the computer screen different cases, different results from both anatomical round implants. And I ask them, now tell me which one do you prefer? And of course, if I will tell you which kind of implants. And usually they indicate some good cases, and in the majority of cases they indicate round implants, and they believe they are anatomical, because actually the shape you can obtain in the vast majority of cases is almost the same. In the upright position, the round implant gives almost always an anatomical shape, thanks to the effect of gravity, of course. Even better under the pectoralis, to me at least. In the recumbent patient, round implant settle back evenly, like normal breast, which tends to move laterally. You know, on the beach, the ladies, they like to, not everybody look at them, oh, this lady has implants. And if they stay like a pyramid, like that, like the anatomical implants, they, of course, they are false, no way. While with the anatomical implants, the problem is that due to the famous form stability, they have to stay there. They cannot move. They don't become flat as a natural breast. I think that I'm not pretty young. I've been in practice for more than 25 years. And I've probably performed so many breast enlargement in so many ladies that they could feel a village now. But fortunately, it would be a village of happy people, and the vast majority has round implants. Actually, only a few specific patients may benefit from the anatomic implant. Those with particular deformities, such as a narrow chest and low position breast, in which a full height anatomical implant will solve the problem, while a round implant capable to fill the upper pole of the breast would probably be too large. A few other patients with a no-shaped breast could also benefit from the anatomical implant, as I showed you in my lecture before. But altogether, these patients are not more than 5% of the total amount. So being able to choose the right teardrop-shaped implant and to properly position it in the breast means to spend a lot of time learning a completely different approach. You knew this from the lectures, and for sure making several mistakes, at least at the beginning. In other words, there is a steep learning curve for more risky implants. Why more risky? Because you know about the rotation, the spinning, the flipping problems. Heden mentioned here as 0.5, but in the scientific literature you find from 10 to 20% of rotation with the anatomical implants, even done by well-renowned surgeons. In that case, because of their shape, the anatomical implant will provide the most unnatural shape. The teardrop shape in this case is not at all an advantage, but a very big drawback. Instead of any rotation of round implants, doesn't give any problem at all. To minimize the risk of local displacement, limit the use of anatomical implant to those very selected few patients. The marketing campaigns...
Just a moment, Dr. Botti. Thank you. Please, one second, please. 1 second. Now, the next 15 minutes, it's time for debate and question from the floor. In an Oxford-style debate, the proposer must be supporting and the places where we are, but the people from the auditorium. Dr. Botti, now it's a wrong podium. Are you supporting that position or that one? Or this one? Or you are so big a guy to fight them in their home? Okay, it was a joke. Me as a chairman, I'm not involved in this position. Okay, thank you, Dr. Botti.